Okay, we are going to be inserting an IV today. I have washed my hands, or performed hand hygiene, and applied clean gloves. I have reviewed the doctor's orders, and I've also provided privacy for the patient. I've closed the curtain. And now I would explain the procedure to the patient. Hi, Mr. Jones. How are you today? Can you tell your name and birthday? Thank you so much. We're going to be applying an IV today. And what that's going to be is it's going to be we're going to insert a little tube into your vein, and it's going to allow us to put all these good fluids in there, and hopefully it'll make you feel a little bit better. So we're going to go ahead and get started with that. I'm going to take my blue pad and put it up underneath your arm. You'll just raise that up for me. Thank you so much. Perfect. We're going to kind of assess where we might want to put it. Right there is looking good. And I'm going to go ahead and get all my supplies ready. All of my supplies are laid out. We're going to go ahead and get tape ready to tape down on the patient's arm. We're going to open up our start kit for our IV. Are going to go ahead and connect our pre-filled syringe of saline into our connector. So this is going to be our pre-filled syringe. And what we're going to do is we're going to twist this off and keep the inside of this sterile and connect the end of this with our pre-filled syringe. First, we have to connect our cannula to the end of the syringe. We're going to keep the end of that sterile, twist it on, and then insert our pre-filled syringe into the end of the connector. We're going to leave that there so that it all stays sterile. And then we are going to take our tourniquet. Wrap it around the patient's forearm. We're going to do it below the elbow so that we can get nice good blood down here. And then we're going to take our alcohol. We're going to go ahead and clean the site and let it dry. And by doing this, we can also be able to see the vein a little bit better. So then we're going to take our IV and we're going to insert it bevel up at a 10 to 30 degree angle. We're not going to touch that again, and you're going to feel just a little sting, but not much. We're going to insert it. We're going to see the backflow, and then we're going to release the needle and insert the catheter. Then we're going to put this in the sharps container. We're then going to tape down the tip of this for stability. And then we're going to connect our tubing. And what I'm going to do is I'm going to flush this tubing, keeping this end sterile. So I'm going to flush it until it gets to the end. Then what I'm going to do is I'm going to connect this to the end of the patient's IV. And then I'm going to flush and assess the site that the IV is at. Once we do this, I'm going to remove our syringe because we're no longer using it. And we're going to apply the Tegaderm. Now this is very sticky, so we're going to make sure to be careful with it. Make sure that it does not get stuck together. We're going to apply this over the IV, over the site. Make sure it's down good. And we would time and date. Then we're going to get ready. We're going to remove our tourniquet. Then we're going to get ready to hang our bag. So what we're going to do is we're going to have our tubing. We're going to make sure to keep the ends of this sterile, so we're not going to let it go everywhere. We're going to remove the tip and insert it into our bag. And we're going to do this while the bag's down so that it doesn't go everywhere. And before I even hang it, just to make sure, I'm going to go ahead and clamp this. Then I'm going to hang my bag. Once this is done, I'm going to let out my tubing. And keep it to where it's not going everywhere. And I'm going to remove this end and keep this sterile so that it can insert into the connector. And I'm going to squeeze this to let the fluid run in and make sure that it's going. And then what I'm going to do is I'm going to release the clamp so that we can flush the entire tubing. Watch it flow all the way down, making sure that there's no air bubbles in the tube. And we're going to let it run into the track. And we're going to reconnect. Okay, there are no air bubbles along our tubing. So we are free to connect this into our site. What we're going to do is we're going to unscrew this portion, and this new portion of the tubing connects to this. So now we have a nice good seal, and we could unclamp it and let our solution run into the patient. But for right now, we're going to take this to the patient's arm. We're going to give it a little coil right here so that there won't be any tension. And then we're going to leave a little bit of wiggle room, and we're going to tape it a little bit past the patient's arm. And now we have our IV site in place. Everything looks great, everything's running great, everything's clear, and now I would assess the patient to see if anything hurt, burned, if he was having any problems with it, and then I would document what I have done.